We're now reconvened from our lunch recess, and we will keep with our agenda and move on to item number 17, which is approval of consent order for Dr. Bradley Suggs.
Madam President, I will need to recuse myself of this matter
Okay.
as Dr. Suggs and I practice together.
All right. Thank you, Dr. Loper.
All right.
Anybody else have any conflicts with this matter? All right. Thank you.
Good afternoon. First, I'd like to introduce Dr. Bradley Suggs and his attorney, Mark Hodges, to the board. You'll hear from both of them this afternoon. We will be obtaining testimony from Dr. Suggs, so I'd ask that he be sworn at this time.
Sure. Tell us where or from the testimony you're about to give us the truth, the whole truth, and nothing but the truth, so help God.
I would just like to make a very short introductory statement, give Mr. Hodges the chance to say anything if you'd like up front, and then let Dr. Suggs explain really what we're doing here. This is a professional sexual misconduct case. The board received a complaint in December of 2023 that Dr. Suggs had engaged in a sexual exchange through direct messaging or text messaging in social media with a patient that it had been ongoing for some time. The board began investigating. Obviously, with serious allegations such as this, we wanted to confirm the information, confirm the accuracy. And we met with Dr. Suggs. Dr. Cleveland met with Dr. Suggs in early February of 2024. Dr. Cleveland confronted Dr. Suggs with the direct messages, copies of which we had been provided and which were of an explicit, some of which were of an explicit or graphic nature. Others dealt directly with interactions with the victim as a patient, including discussions of refills, et cetera. Dr. Suggs admitted that the direct messages were genuine, that he had sent them. He admitted the conduct. And at that time, and to this day, we have received no evidence that this relationship developed beyond the personal and messaging stage and it never blossomed into a physical relationship as far as we have been able to determine. Dr. Suggs signed an agreement not to practice medicine, a copy of which is on your Surface Pro. He also, at the same time at that meeting, agreed to go for a comprehensive psychosexual evaluation. Essentially, Dr. Suggs asked us, what would the board require of me if I go to a hearing and get suspended? And we said, well, the first thing they're going to do is going to send you for a comprehensive psychosexual eval and any treatment follow-up. And you're very likely to be removed from the practice of medicine. So he signed the agreement not to practice. He went for the evaluation in March of 2024 at Pine Grove. Pine Grove issued an evaluation report on April 8th, 2024, copy of which is in your materials. The evaluation stated that in their opinion, Dr. Suggs was not safe to practice at that time and recommended intensive inpatient or at least partial inpatient treatment of a minimum of 6 weeks. Dr. Suggs went and participated in, I believe, the professionals enhancement program at Pine Grove. He completed that course of treatment and he has complied with all of the requirements that the executive director suggested of him. You have the discharge summary in your materials. The discharge was June 18th of 2024, and the report was finalized on July 11th of 2024. At this time, for the record, I would like to introduce some matters without objection. So I mean, some documents without objection. I will state that I do not plan to introduce into the record documentary copies of the evaluation and the treatment records of Dr. Suggs. I believe that would invade his privacy. There's certainly, the board has them available and can discuss those portions of them then they deem appropriate with Dr. Suggs. However, I think that putting a documentary copy out to the public serves no purpose. So the documents which I'm going to officially make part of the record are the agreement not to practice medicine, and again, under seal, I guess is the appropriate way to say it, is it's MSBML 8 through, excuse me, dry fingers. I believe it's MSBML 40, which is the comprehensive psychosexual evaluation performed by Pine Grove. Bates number MSBML 41 through 54 is the Pine Grove discharge summary from the professional enhancement program. We'll be discussing at length the proposed consent order, an unsigned copy of which is in the materials as Bates numbers MSBML 1 through 7. And I do want to report that Dr. Suggs, through his attorney, has provided the original signed copy of the consent order this morning, and we have it in our possession. I would like to add one other document. We will have to get copies of this and get it scanned to put on your Surface Pros. This is the results of a drug and alcohol screen, which Dr. Suggs underwent. The collection was on January 7th of 2025, correct? And they brought this with them today. We'd like to add that to your materials. That said, I'm not going to go into any more of the details. I'll let Dr. Suggs explain to you about the relationship, but that's the evidence that we plan to present. And at the end of the hearing, we will ask that you approve the consent order, and we will talk through the provisions of that in detail. That's all I have at this time. I will next call Dr. Suggs, but if Mr. Hodges has anything he'd like to say, I'd like to give him the opportunity.
Calling that the exhibits be admitted into the record at this time.
I am, unless Mr. Hodges has any objections.
No, ma'am. Thank you, Paul. Madam President and Board, you give a lawyer a chance to talk, he's always going to say yes, but I'm going to be very brief here. We are here strictly to cooperate in this proceeding. Dr. Suggs has cooperated throughout this process, and I hope that will come across today in his testimony. Excuse me, in the documents before you. I would point out that if I say something or make a point, it is not intended to defend Dr. Scruggs' conduct. Okay, he has accepted responsibility for conduct that was unprofessional. As Mr. Barnes said, this did not escalate to anything beyond the virtual communications on social media. It happened while he was on deployment with the U.S. Army in Kuwait, and did not continue thereafter. But having said that, the rest of our comments, both Dr. Scruggs and myself are going to be directed at showing his compliance with the consent order and the recommendations of Pine Grove, even though we realize those are technically not in effect yet. So don't please take anything I say as being presumptuous on that. It's just intended to show his good faith in being proactive on setting things up so that he'll be in a position to comply with everything in the Pine Grove recommendations. Thank you.
I call Dr. Bradley Suggs to the stand. Suggs, over here. Good afternoon, Dr. Suggs. We have met before when you came here to meet with the executive director, correct?
Yes, sir.
And I'm going to try to be direct and matter of fact about your testimony and the questions that I asked. There are some that are obviously of very sensitive nature. And even though I'm asking you the questions, the jury, the judges and jury for determining whether to accept your consent order are the board members. So if you would, try to direct your responses to the board. And I'll try to ask you to tell the board and that sort of thing. Because I can't make the decision.
Yes, sir.
Right. So you signed an agreement not to practice back in April of 2024, correct?
Yes, sir.
And since you signed that agreement, you have not practiced medicine in any jurisdiction.
That's correct.
When you met with the executive director back in February of 2024, the director handed you some printed copies of some text messages, which were explicit and even graphic in nature, correct?
Yes, sir.
Did you recognize those text messages?
I did.
And did you, at that time, freely admit that they were genuine?
Yes, sir.
Also, you admitted that you had been the physician for this patient for an extended period of time.
Yes, sir.
You admitted that while you were deployed with the military forces in Kuwait, that this relationship had progressed to sexualized direct messaging through, I believe it was the Instagram app. Is
Yes,
that
sir.
right?
That's correct.
You also told us at that time, and I want you to confirm with the board that the relationship did not progress further into the physical stage. Is that correct?
That's correct. It did not.
Okay, remember, please
Sorry.
tell the board if you can.
Yes, sir.
Why not?
It was a fantasy. I'd never meant for it to, never intended for that to happen.
Now, in the text messages, which I've not actually provided copies of the text messages to the board members, but they're certainly entitled to receive copies if they'd like. But you did, in addition to the sexualized messages, there were also interspersed with messages about this patient's medical treatment, including like requests for refills for medication. Correct?
Yes, sir. I think we discussed that when I got home, I would refill her medications.
Right. And for what conditions were you primarily treating this patient? What type of conditions?
Primarily psychiatric anxiety.
And as you sit here today, you do not deny that your conduct with this patient, the texting, the personal relationship that developed was unprofessional and unethical.
I don't deny that. Yes, sir.
One moment. Did you give Dr. Suggs a copy of the documents? Got an extra. Dr. Suggs, I would ask that you look at the evaluation report. If you look in the bottom left-hand corner, you'll see the numbering. That's what we call Bates numbers, and this is Bates number 8 is where it starts.
Yes, sir.
Okay, we literally on the same page.
Yes, sir.
And I'm not going to ask you about this entire 20 or 30 page document. The bottom of that first page, as part of the executive summary of findings, the last sentence says that it is clear that Dr. Suggs' conduct with this patient constitutes a severe boundary violation and warrants intervention at this time. And you admit and agree that that is correct.
Yes, sir.
Now, on the next page, and you can look through this first 2 or 3 paragraphs, initially, you told the evaluators that this direct messaging between you and the patient was confined to 2 to 3 days while you were deployed to Kuwait, correct?
Yes, sir. I believe
Okay.
so.
That was not in fact accurate, was it?
It was not.
And later you admitted to them that this messaging had begun at what point?
Maybe a month before I left, there was more messaging.
Did you and this patient ever have any face-to-face encounters where you discussed anything beyond the doctor-patient relationship?
No, sir, we did not.
And looking at the other discussion on page MSBML, page 9, I'm just going to highlight a couple of sentences. The first sentence of the third paragraph. Further, while Dr. Suggs did not currently endorse sufficient criteria to warrant a diagnosis of compulsive sexual behavior, he did endorse several concerns, previously including having engaged in sexual behaviors despite risk of emotional harm to others. I just want to be clear, and I believe this discussion goes on to say some of those were with coworkers, but none of those were with patients, correct?
Correct.
This direct messaging relationship with this patient is the only sexualized relationship you've had of any type with any patient, correct?
Correct.
The last sentence of that paragraph states, given all these factors, a compulsive sexual behavior problem cannot be ruled out at this time, and we're recommending this issue be further explored during a treatment course described further below. At the bottom of the page, next to last paragraph, the evaluators opined that we do not believe that Dr. Suggs is currently fit to practice medicine with reasonable skill and safety. We believe that prior to returning to practice, he needs to complete a minimum of 6 to 8 weeks at a MSBML approved treatment center for professionals at a residential or partial hospitalization level of care designed to treat professional boundary issues as well as other vocational professional issues and psychiatric concerns. Following successful completion of treatment, we also recommend that Dr. Suggs be monitored by the MSBML. I read that accurately.
Yes, sir.
And you're aware that that was the evaluation
Yes.
team's conclusion?
Yes, sir.
And did you follow the recommendation of the evaluation and go for treatment?
I did. Yes, sir.
Okay, and that was approximately, I believe it was in April.
April of the 22nd, I believe.
Okay, and that was of the year 2024. Since we just switched to 2025, I have to be careful about getting the year wrong. And if you would, Dr. Suggs, I'm going to get you to turn to page 38 is the Bates number page. And the board, of course, has the complete evaluation and can review all of the detailed information described there. At the bottom of page 38, there's a heading Diagnostic Impressions. Then you have to flip over the next page to get the diagnostic impressions, which are described as other problem related to employment, in parentheses, professional sexual misconduct, adjustment disorder with mixed anxiety and depressed mood, unspecified trauma-related disorder, and rule out alcohol use disorder. Again, then under the recommendations, the Pine Grove evaluation team expressed its opinion about fitness and recommended the intensive treatment, monitoring contract with MSBML of at least 5 years. And those are the primary recommendations from the evaluation. All right. During your treatment in the professional enhancement program, what did you learn about yourself and what might have led to this behavior?
I definitely learned that my previous traumas with some circumstances that I went through when I was younger definitely had more of an effect on me than I realized. I learned that I definitely did not process conflicts and things in a healthy way and process my feelings in a healthy way, and have definitely learned coping mechanisms to be able to do that. Yeah, I mean, I think that was the biggest things that I definitely sought maladaptive or used maladaptive behaviors to cope with feelings and with situations that I didn't know how to process, I guess.
Did alcohol use factor into these problems?
I would drink socially, yes, sir. I don't think that I used it as a coping mechanism so much, but I don't think that I made good decisions when I did drink. And so,
Did the use of alcohol, in your opinion, have anything to do with your engaging in this, sexualized messaging relationship with this patient?
no, sir, not with this patient.
All right. On page 51, at the top, the discharge summary, last sentence states, and I'm starting in the middle of the sentence there, base, but that Dr. Suggs faces some uncertainty at discharge as his medical license is still inactive, and the consideration of a therapeutic separation from his wife to work on the future of the relationship. As such, his prognosis is guarded, but should improve as he follows the recommendations below. And then there's 2 sections there of recommendations: return to work recommendations and aftercare recommendations. Are you familiar with those?
I am.
Okay. I'm not going to ask you about the aftercare recommendations. Those are treatment issues, and the board has that information available that they can view it. But I don't feel it appropriate to ask any questions about that in this setting. Before we move on to the consent order, is there anything else that you would like to tell the board? And they'll have a chance to ask you questions. You're aware of that, correct?
Yes, sir.
Is there anything else you'd like to tell the board about this conduct and the consequences that you are facing and that you have already faced and the consequences that you'll be facing in the future?
Just it's not who I am as a person, and that I am deeply remorseful and regret my conduct and the harm that it has caused. And want to, do everything I can to make amends and ensure that, nothing like this ever happens again.
All right, and Dr. Suggs, I do want to ask you a couple of additional questions to make sure that you and I are on the same page. You understand that there is a power imbalance between physicians and their patients,
Yes, sir.
correct?
Yes, sir.
And you understand that any personal relationship or sexual relationship which a physician engages in with a patient necessarily plays off that power imbalance and puts the physician in a position of ability to leverage the patient or encourage the patient to satisfy the physician's needs rather than the patient's needs. Do you agree with that?
Yes, sir.
Okay. But if you would, Dr. Suggs, you should have a copy of the proposed consent order. Probably all in one.
Yes, sir.
And this is on page 3 of the agreement, and it also happens to be MSBML 3 in a strange coincidence of numbering. I'd like to walk through the terms of the consent order that you're asking the board to agree to today and make sure that you express your understanding and agreement. And first, everyone knows that your attorney, Mark Hodges, is with you here today. He has been your attorney throughout this process, correct?
That's correct.
He attended the meeting, the initial meeting with the executive director with you,
Yes, sir.
and he has provided you with advice and consultation throughout.
Correct.
Paragraph 1 on the proposed consent order states your license to practice medicine is hereby suspended for a period of 1 year from the date of acceptance of the consent order, with 9 months immediately stayed, such that he may return to the practice of medicine 3 months from the date of the entry of this consent order, subject to compliance with and completion of the terms and conditions of this consent order. Dr. Suggs, do you understand what 9 months immediately stayed means?
Yes, sir. I guess I'm assuming that's time served, basically. But since my agreement not to practice to this date.
And it's not officially, but yes, we are recommending this to the board based on the fact that you signed the agreement not to practice and that you have voluntarily, limited yourself to not practice medicine for 9 months to this point. Now, in order for you to carry out the recommendations, the return to work recommendations that are contained in the PEP return to work recommendations, you have to be practicing medicine, correct?
Yes, sir.
The next paragraph in the consent order, paragraph 2, states that you shall adhere to all program recommendations rendered by the evaluation facility in its final report and specified in the Pine Grove discharge summary dated July 11th, 2024. Do you understand that means that even if it is not described specifically in this consent order, you're bound by the recommendations in the evaluation and then the discharge summary?
Yes, sir.
And you are bound to the specifics of those. I have summarized that where we have summarized those in the consent order, but they are contained in detail in the discharge summary, correct?
Yes, sir.
All right, and let's just very quickly go through those return to work recommendations. A 5-year monitoring contract with the Mississippi Physician Health Program. And you understand that as a part of that contract, that would include monitoring by MPHP, and that MPHP would be able to set such terms as they deem necessary to monitor your compliance and avoiding issues with alcohol or substances.
Yes, sir.
B, workplace monitoring. You understand that you'll have will need to have in place a workplace monitor who can observe your behavior, who knows about this event and the circumstances, and who can make reports concerning that.
Yes, sir.
You understand that you would have to undergo periodic polygraph testing,
Yes, sir.
right? You would be required to use a scribe for female patient encounters.
Yes, sir.
There are workload limitations which are specified, in the discharge summary. You're aware of those limitations?
I am.
You would be limited in the number of hours you could work per week.
Yes, sir.
If there was a change, if you improve and you believe that you could handle a higher workload and still, keep your conduct in line, you understand you would be able to speak with MPHP and then come before the board and ask for those limitations to be relaxed.
Yes, sir.
Okay. There are additional workplace boundaries. It's the way I've described it. There's actually quite a list in the discharge summary. Are you familiar with those?
Yes, sir.
It includes such things as no meeting alone with female coworkers, not attending social media event, not having social media accounts, no treating or prescribing for yourself, family, friends, or coworkers, no contact with patients outside of regularly scheduled appointments. You are familiar with and understand all that.
Yes, sir.
Okay. G says that Dr. Suggs shall return to PEP 6 months after his return to practice for a recheck as specified in the discharge summary. So that was originally scheduled to take place in December of 2024, correct?
Correct. Yes, sir.
And are you aware that your therapist and someone connected with PEP contacted the board and said that that should be postponed till after the board hearing because it really, to be productive, needed to take place after you had returned to practice?
Yes, sir. That's correct. To see how I was working within the guidelines given to me.
Okay. Paragraph H, Dr. Suggs shall abstain from all alcohol and other mood altering substances.
Yes, sir.
And so you understand these requirements, Dr. Suggs, and just to be clear, make sure you're confirming to the board that you agree to each of these.
I do, and I agree to all of them. Yes, sir.
One moment. Beg the board's indulgence. Turning back to page 3, Dr. Suggs, is something that we didn't talk about. And I want to make sure you understand. The period of suspension for your license is 1 year. Even though 9 months are immediately stayed, you cannot return to the board to ask for any lifting of limitations or restrictions sooner than 1 year from the date of the approval of this consent order. You understand that?
Yes, sir.
And do you understand that the intent of the timeline set out in the consent order is that you would have an additional 3 months of active suspension to serve, that you would then be allowed to return to work, subject to all of the workplace restrictions in the discharge summary, correct?
Yes, sir.
And then that would give you, and there'll be an additional 3 months after that, at least 6 months under that. That gets you to 9 months, 3 months later, if the circumstances warrant, and if you have good reports from MPHP and an evaluator, then you could return and ask the board to modify the requirements of the consent order, the limitations. Do you
Yes, sir.
understand that?
Yes, sir.
And do you agree to that?
Yes, sir.
Attend to the witness.
Board's indulgence for a moment, please.
And thank you, Mr. Hodges, for pointing out my oversight. There's a letter, it's page number 54. You may have seen it was the last page in the original packet, a letter from Lizette Turner, who is Dr. Suggs' therapist, stating that her opinion, he should be able to practice without restrictions. So they provided that to us, and I wanted to make sure that it was noted for the record. Thank you for pointing that out.
I do want to state that we're not here asking that he be reinstated without restrictions. And we didn't ask her to put that in the letter. That's just something she added. The point was to show that his therapist has been working with him and he's in compliance with, that's part of his compliance with the recommendations of Pine Grove that are incorporated in the consent order. My goal now, and I'm going to try not to belabor this because I know your time is limited and valuable, but I do think it is important for you to get a feel for how seriously Dr. Suggs has taken this. And forgive me if I mispronounce his last name. I've known Dr. Suggs since he came out of training. He's been Brad to me since that time. So if I occasionally call him Scruggs or Suggs, I don't mean to do that. But I care a lot about him. So I think he needs to tell you some of this stuff. And I realize we could claim HIPAA or whatever on some of this, but I want you to hear it from him. When Mr. Barnes asked you about the emotional traumas of your childhood that you did not, and I guess your young adulthood, that you had not adequately coped with, would you just in brief describe for the board, Dr. Suggs, what those things were?
Yeah, the biggest one was my brother committing suicide at 21.
And how old were you?
23. And then my daughter was diagnosed with leukemia when she was 3. And then most recently, my wife diagnosed with breast cancer 3 years ago now. So
And
those
did you actually have to plan your brother's funeral because of your parents' emotional stuff?
Yes, sir. Yeah.
And what did you learn? And Mr. Barnes kindly asked you this, and I don't want to belabor it too much, but I want you to explain to the board what you've learned about how those traumas that you didn't deal with properly manifested and how you have developed through what you've been doing the last 9 months, ways for coping with those.
Yeah, I mean, I've always just kind of been the one who took care of everything. And so I think I never sought any way to cope with those things or to process those things. Pine Grove showed me that I really compartmentalized and suppressed, feelings and, developed maladaptive behaviors to cope with them and with feelings of inadequacy or seeking validation. And that's kind of what led to my, the escalation of the behaviors.
Did Pine Grove diagnose you with any specific addiction like alcoholism, or what was their view of what your underlying issue was?
It was basically like a unspecified trauma disorder, stressor related disorder, didn't meet criteria for PTSD, and then a adjustment disorder due to those stressors were the big, and then the professional sexual misconduct.
And To briefly diverge on that, I want to clarify something that Mr. Barnes asked you. You did admit to Pine Grove that your direct messaging comments with the patient that led to the complaint that we're here about today actually started before you went to Kuwait, correct?
There were messages before I left, yes, sir, and they became more sexualized while I was gone.
Okay, and that was going to be my question. Were the direct messages that you had with this patient before you went to Kuwait of a graphic or sexual nature?
No, sir.
I think the report from Pine Grove characterized them as flirtatious?
Yes, sir.
Would that be accurate?
Yes, sir.
Had you communicated with her through this medium previously
Yes, sir.
to that time?
Yes, sir.
In what way?
Just, she would comment on a story or a picture I'd put up from a concert or something like that. There was nothing more than that.
In the time that you would see her in your office prior to deployment, was there ever anything that seemed off?
No, sir.
In your assessment of yourself to the extent you
No,
had
sir.
a self-appreciation, or in her?
No, sir.
And did you see her as a patient after your return from Kuwait?
I did
How many times?
twice, I believe.
Was there anything in those encounters that was different from what you would have with any other patient?
No, sir.
Do you have any explanation for why that's the case?
I mean, I was embarrassed and ashamed of my actions and basically wanted to pretend it didn't happen. And so I kind of went about business as usual, and I was making the assumption she felt the same.
And then when you became aware, I guess in February, from Dr. Cleveland, of the situation, did you continue your relationship with her, your
No, sir.
patient relationship with her?
No, sir.
And what did you do?
We sent her a letter, certified mail, that I could no longer, provide her care as her physician, and that we would, seek, cooperate with getting her set up with a new primary care physician.
And in that letter, did you tell her that your communications with her from Kuwait had been inappropriate?
I did.
So tell me, doctor, what you have been doing since you got out of Pine Grove to help you. I assume from what you're saying, you developed some better habits, mental health habits, through the Pine Grove effort. What have you been doing since that time through today to continue that?
Spending a lot of time with my kids, in a taxi most days, going to my therapy sessions, my group sessions, attending 12-step meetings, and some hobbies, playing guitar, playing golf, reading, playing sports and video games with my kids.
Well, I guess I noted one of the Pine Grove recommendations was that you have some non-using recreation or hobbies. Are those the kinds of things that you've done?
Yes, sir.
Have you become involved or more involved in your church?
I have. Yeah, I'm involved with chaperoning my kids' youth group. I've just recently volunteered to attempt to play with the praise band at our contemporary service. So yes, sir, being more active and involved.
Have you kept your therapist involved or informed of all these things that you're doing?
Yes, sir.
And just to clarify, excuse me for a moment. As Mr. Barnes correctly pointed out, the letterhead, and this is MSBML page 54, which I believe is Exhibit 5. The letterhead says Lizette Turner LLC. It has a different name. What is your therapist's name?
Yeah, Deborah Schiller is actually my therapist. I think it's on Lizette's letterhead, and then Deborah Schiller is listed underneath her as well. But Deborah Schiller is my therapist.
And does Ms. Schiller have any relationship with Pine Grove?
She is a former counselor at Pine Grove. She worked in PEP, and I believe at Gratitude as well, which is the sex addiction treatment program.
And explain, as I understand, there are two kinds of therapies that you're doing with her?
Yeah, I'm doing both individual and then also a group of professionals of other physicians who've gone through similar circumstances.
And do you, you mentioned the 12-step programs, which I think we sadly all are all too, or thankfully are all too familiar with these days. How many times a month do you attend those meetings?
2 to 3 a week.
And do you have a sponsor
I do.
that you can call if you're feeling particularly stressed or needing to speak with someone?
Yes, sir.
Your discharge recommendations included, of course, follow up with the licensure board, which did occur. Follow up with Leanne Germany, LPC, and with Deborah Schiller, who you've already told us about. Did you go see Ms. Germany?
I did. I set an appointment. At my initial appointment, she let me know that she did not take my insurance. And so at that time, she recommended using Ms. Schiller for both my individual and group therapy. I cleared that with Pine Grove, and since Ms. Schiller had been faculty there, they were on board with allowing me to do both my individual and groups, both with her.
Okay. Now, under the consent order, would be under, I guess, jurisdiction of the MPHP, as I understand it.
That's my understanding.
Prior to now, was there some question about whether you would be under MPHP or directly under the board?
Yeah, I'd heard somewhere, I don't remember exactly who told me, that there was a question whether I would be monitored by the board directly or by the PHP.
But you understand, as you told Mr. Barnes, it would be MPHP.
Yes, sir. That's my understanding.
And I know that this order has not been approved, much less signed, but once you learned that it would be MPHP rather than the board, have you done anything to try to facilitate future compliance with your MPHP relationship?
Yes, I sent an email over to establish with the PHP. I have a meeting with them next week. In the process of filling out my intake forms, and have submitted over. Pine Grove has sent my discharge summary, and I sent my toxicology screenings from last week over.
Okay. And they understand and you understand that none of that happens unless this gets approved today.
Yes, sir.
Now, you mentioned these screenings, and we have in evidence, thanks to Mr. Barnes's courtesy, that Exhibit 4, the drug and alcohol screen. And I've worked in healthcare for 35 years. I still didn't know what a PEth test was. And I've always laughed at alcohol tests because they're usually good for about 8 hours. But could you explain for any board member who might not know what that PEth test is?
Yeah, because I didn't know until April either. It's basically a A1C for alcohol. It's a metabolite of alcohol, phosphatidyl ethanol, I believe, that sticks to red blood cells and is good for about eight to 12 weeks of detection for heavy alcohol use.
So that test was negative. That would indicate that you had not been drinking alcohol during that previous 8 to 12 months.
Yes, that's correct.
Have you had any alcohol since the time that you went to Pine Grove?
I have not.
Do you have any social media accounts?
Do not.
Do you have the cell numbers of any patients or employees from your former practice
Do
in
not.
your cell phone?
I do not.
Did you ever have any patient cell numbers in
I
your
did
cell
not.
phone?
No patients.
Have you, I'm continuing for the board's reference, the recommendations, return to work recommendations of Pine Grove. It's page 11 of 13 of their report. And I'll give you a cite for the record. It ties it to the exhibit. It'd be MSBML 4051. The second recommendation is that you identify a workplace monitor who will provide regular updates on your activities to, I guess, MPHP, we now know. Have you taken any steps along those lines?
I discussed with a now former employer kind of what that would look like. And if I do go back to practice there, I think we've discussed making preparations using, a clinic administrator or someone along those lines to, inform them of everything and to be monitoring my behavior at work.
And have you kept your employer or your now former employer informed of everything that's happened in these proceedings, all the way going back to the meeting with Dr. Cleveland?
I have.
Are they aware of all of these Pine Grove recommendations and aftercare requirements?
They are.
There's another recommendation that you have a scribe present. I know Mr. Barnes has asked you about that and you said you understand it. Have you had conversations about how that might look if you go back to your former employer?
We have, yeah, they having a nurse or a medical assistant, go in the rooms with me to chaperone for every visit with a female patient.
So as I understand it, there would be the scribe who might be different people on different days, but there would be this monitor person who would be your continuous person who would be reporting to MPHP on any problems or. any
That's my
questions they have.
understanding. Yes, sir.
Have you attended any social events with any of your former coworkers
I have
since
not.
this all went down?
I have not.
Have you had any interaction with any patients since this all?
I have not.
Have you treated any member of your family or any of your friends during this time frame?
I have not.
And you've made clear that you haven't treated any people during this time you agreed not to practice. Have you done anything related to the fact you're a doctor?
I attended a school under the approval we requested with Dr. Cleveland to allow me to attend a school for the military for being a flight surgeon. And that's the only thing that I've done.
Okay, sure.
But there was no clinical practice or anything involved, and it's strictly PowerPoints and playing with helicopters.
And your activities, if you're licensed, if you're allowed under the consent order to resume practice, would your arrangement with the guard and your flight surgeon certification allow you the chance to work if some of these other things don't work out in the short term?
That's my hope.
I know that there was a financial spending issue that the board members may have seen in the report. I know I did. And there was a recommendation that you get rid of applications that had instant purchase options in them. Have you done that?
I have.
Have you had any steady source of income since April?
Not steady. Selling material possessions, guitars and four-wheelers and things like that. And then doing odd jobs for friends who own farms and have cows and things like that.
And then would you get some weekend pay for your guard drill the months you had?
Yes.
Have you been able to have your financial situation, which I know was one of your stressors, at least under enough control not to have to declare bankruptcy or
Yes.
anything like that?
Yeah, so far.
And in that, I noticed one of the not requirement, but a recommendation of Pine Grove was that you engage a financial advisor.
I've spoken with one and hope to utilize his services as soon as I actually have finances to advise on.
Okay. And have you done these like quarterly in-person, these weekends at Pine Grove?
I have not.
Have they had, you mentioned the encounter with, I believe, the MPHP physician
Yeah, that was at the alumni weekend
at Pine Grove?
at Pine Grove. Yes.
Okay, I may have used the wrong term.
Yeah.
And I hate to ask this, but I know during the time we initially interacted with the board, with the executive director, you were in the process of trying to save your marriage. Have you been able to do that?
No, sir.
Are you presently divorced?
Not yet.
Did your wife agree to the recommended couples therapy that Pine Grove recommended in its report?
No, sir.
Do you feel like what you've built into your coping skill set is enough to help you with dealing with the loss of your marriage?
I do. I have a good support system, friends and family, and able to utilize a lot of the skills that I've learned through this whole process. Just taking it, one day at a time and trying to do the right thing. It's all I can do.
Putting aside that what's before the board, but as from a mental health standpoint, just as a human, do you feel like this is all behind you now? I mean, you've whipped this?
No, no, sir. I'm hoping the worst part of it is behind me, and hoping, my inability to cope in a healthy way when I do have problems arise is behind me. But, I think this is, going to be something that I have to continue to work on.
And are you committed to doing that?
I am.
Is it important to you to be able to return to primary care medicine and take care of folks?
Yes, sir. Absolutely.
Board's indulgence for just a moment. Thank you. I have no further questions.
Dr. Suggs, I just want to make it clear for the record. It appears to me that the ambiguity about who would be performing the monitoring duties came up in the evaluation report where it
Okay.
said that you should be monitored with MSBML, and then later in the discharge summary, there was discussion of MPHP. Do you understand that flirting with patients and flirtatious messages, whether they are flirtatious messages or interactions with patients, are inappropriate,
Yes, sir.
even if they're not blatantly sexual?
Yes, sir.
Yeah. And Mr. Hodges asked you about, whether you felt like this was behind you. You said you hoped the worst was. So, do you feel that you are mentally and emotionally, fit to return to practice, subject to the return to work recommendations?
Yes, sir. I do.
That's all I have.
Hi, I'm Michelle Owens, board president. I guess we've heard quite a bit about your story and kind of what brought you here. And you've been through some evaluations, and there have been recommendations that have been posed as a result of those evaluations. As you sit here today and think about them, what are your thoughts about the recommendations that were made by the people who have evaluated you and the assessments that they made about what they believed of you at that time?
I mean, at the time I was shocked. I felt like I was getting along pretty good. After going through the 8 weeks in Hattiesburg, I definitely came to understand that I wasn't getting along near as well as I thought I was with my coping skills and my, obviously using less than ideal behaviors to manage my emotions or my suppressing of them. I mean, it's a cliche, I guess, but I mean, I think that this is going to end up being a good thing in my life, that it's gotten kind of turning me on the right path of dealing with a lot of my unresolved traumas and a lot of being able to resolve conflict in a healthy way and being able to be a better physician for my patients and a better dad for my kids and member of my family and church and community.
Well, admittedly, you've had a lot of very difficult challenges in the course of your life, and people deal with those kinds of things differently. But I think considering what you've kind of had a tall order. I mean, these have been some pretty significant experiences, and I think any of us who just had to deal with one of those might have difficulty being able to take it all in and take it in stride, that part. So, but you don't feel that at least the recommendations were unreasonable.
I understand where they're coming from. I understand it's about, ensuring that I'm fit to take care of my patients and that I'm not a risk. And so, yeah, I understand where they're coming from. That I know they're on the conservative end, I would say.
Do you think that the compliance with those recommendations actually helps to prove to them things that, or at least help to resolve or clarify some things that may be deemed questionable based on your actions?
I do.
And I think in this in particular, I know that you have been compliant with therapy, and it speaks to a lot of the conversations that you've had, but have you had any particular like trauma related or therapy that specifically is like trauma informed therapy or anything of that nature?
During my 8 weeks in Hattiesburg, I did a lot of the EMDR work. And then I've done some more continued just cognitive behavioral therapy with my therapist around a lot of it.
And the last part, I guess, is can you tell us a little bit about your current relationship with alcohol?
I haven't drank since April 8th of last year.
Those are all the questions that I have. Dr. Joyner is one of our board members who's also joining us remotely on Zoom. I don't see that he has a hand up or anything, but Tom, if you have any questions, just please make sure you let us know. Don't want to forget you. Any other questions of any other board members? Dr. Lippincott?
Thank you, Madam Chairman. I'm Ken Lippincott. I'm a psychiatrist from Tupelo, and I must say you're one of the most thoroughly evaluated and treated individuals I've seen. But that being said, I was a little surprised when you testified that you didn't feel that the alcohol contributed to these behaviors. Were you not drinking?
With that patient, I was not drinking in Kuwait. Yes. Kuwait is a dry country. Essentially, we were not allowed to drink alcohol while we were deployed there.
What about before Kuwait?
I think some of the behaviors before alcohol contributed to my behaviors. Yes, sir.
And was that not identified as one of the problems? It was problem 5 from the Pine Grove evaluation, says substance use disorder, alcohol, and they had recommended. They said something about engagement in a 12-step recovery program. Have you been engaged with any 12-step recovery?
Yes, sir.
programs?
Yes, sir. I'm in doing SLAA meetings and doing occasional AA meetings as well.
Okay. Very good. I don't have any further questions. Thank you for your service.
Thank you.
Dr. Roth, you had?
Tell me, yeah, I'm Randy Roth from Pascagoula. I'm a hospitalist and internist. Tell me what your typical practice was like prior to this incident. Tell me what you did.
So primary care and urgent care here in Jackson or in Flowood. I saw anywhere from a slow day would be 20 to 25 patients a day. During flu or COVID season, 60, 65, 70 some days. Mix of primary care and episodic.
Did you have any boundary issues when you were a medical student or a resident?
No, sir.
They mentioned the use of polygraph. Is that a recommendation or is that already done?
I've done 2 already, and then we'll be doing subsequent, I'm sure, with my monitoring.
So under polygraph, were you asked whether or not you had a sexual relationship with the lady that you dealt with in Kuwait?
I was.
I mean, did you traditionally communicate with other patients via social media platforms, male, female, anybody?
No, sir. I'd get occasional random messages from patients asking for refills or when I would be in the office or things like that, and I would direct them to the clinic.
So how did she end up back in your office? Did she have, you come back from Kuwait and she just shows up for a routine follow-up visit?
Yes, sir. Yep, just for regular maintenance of refills and things like that. And then the second time was for an acute complaint.
Thank you.
Any other questions? All right. Dr. Suggs, is there anything else that you wanted to share with the board in relationship to this matter? Anything that maybe our questions did not touch on, but that you felt was important or pertinent to be said in this forum that has not already been articulated?
I can't think of anything. I appreciate all of your time and your consideration.
And we do thank you for your service.
Thank you.
You can be excused.
I don't have any sort of closing statement, but I did want to clarify something Dr. Roth asked. It's on page 51. It's the Bates number page. The return to work recommendations, number 3, states that quarterly polygraphs are recommended for the first year. With past polygraph, these can decrease to biannual thereafter. Polygraph questions will need to include questions around honesty with sexual behavior, maintaining appropriate workplace boundaries, and substance use. He will also need to be asked if he is engaged in any new addictive behaviors. That's all I have.
No, ma'am. Thank you.
All right. So we've now heard the testimony of Dr. Suggs as well as the attorneys in this matter. Just to kind of remind everybody, there's a consent order that is behind tab 17 that we are to make a decision on. And I just want to, one issue within this, Paul, if you can clarify for me, the specific language in here specifically speaks to use of a scribe present for female patient encounters. A scribe is usually different from a chaperone. And so just for the purposes of clarity, how are we are we intending to address, is that intended to be considered synonymous with a chaperone? Or is it intended to be what it says, which is a scribe, which is a little different? And it's just for that's a clarification for me.
I apologize. I'm eating a piece of candy.
I'm like the waitress at the restaurant that asks you right when you put something in your mouth. Right?
In the more detailed return to work recommendations, it specifies it is recommended Dr. Suggs maintain a scribe who will be present for female patient encounters to provide accountability. So the reason we put those directly in is that 99% of the time when the board enters an order in a sexual misconduct case, you say, comply with all requirements and recommendations of the evaluation. So that's why we put it in here. Of course, you can make that more clear and offer that as a modification to the consent order if you wish to make it clear whether it's a chaperone or something less than an official chaperone.
The reason I asked that question is because a scribe, as we use it in the clinical setting, is a person who's there to transcribe during the encounter. That person if you are a scribe, there is no requirement of a scribe to be present during an intimate exam. I'm just, look, speaking from the world of OBGYN. So I just want to be clear as we're doing this, like, is that something that needs to be clarified? Or am I reading that wrong and that the intent was really just for a scribe? Or is it something that's intended to be really meaning a chaperone, but the term used to scribe? You see what I'm saying? Does that make sense?
I certainly concur. I was gonna ask the same question. I mean, I can't know if I can say anything. Do you currently, have you used a scribe in your practice prior? So Dr. Owens is.
intent is a chaperone.
That's what
I
I
think-
believe that, but
think so too.
the language does not necessarily line up, and those things they are distinctly different, because chaperones don't always scribe and scribes don't always chaperone.
The scribes might be looking down at what they're writing instead of looking at what's going on. We had the same conversation, as you would guess from his age. He's not anyone who's ever used a scribe, but so we, in talking to his former employer, have worked from the assumption it needs to be a female person who's watching what's going on. I didn't want to get into questioning the proposed language on that because it came out of Pine Grove. It's not Paul's language. So, but I concur with your point, Dr. Owens, and we would be amenable to whatever y'all felt was appropriate for a different word from scribe.
I mean, certainly we could change that word to chaperone and approve it with the change.
That modification, I think we probably would need somebody to potentially suggest that. I think that would be a reasonable modification. I don't know if I can make that, I can make that suggestion, or if somebody else needs to, but I do believe that distinction needs to be made.
I'm happy to make that suggestion that this be amended to reflect the female chaperone in place of the words of scribe.
Certainly, but we were very curious.
All right. So is there a motion?
We've got a motion at second.
You can't.
Do we have a motion?
Yes.
I
No.
think that was just about the language.
That was for
Okay.
a proposed alteration of the language.
I'll make the motion though to accept the consent order as is.
No, as with the recommended amendment?
Yes.
Okay, not as it. Seconded by Dr.
You
Gersh.
just got you.
Okay,
I got you.
so the motion is to approve the consent order with the amended language, which is the change from scribe to chaperone. It has been appropriately moved and seconded. Any further discussion on this issue? Dr. Joyner, we're preparing to vote. Any further discussion? Hearing none, all those in favor say aye.
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 Any opposed? Any abstentions? All right, so the motion carries and the consent order is approved. Thank you. Thank you, gentlemen. All right, so now we'll move on to the next agenda items, which is about the need for subpoenas. So looks like we're gonna potentially need to consider executive session for these.
Yes, ma'am. And I was going to suggest that and ask that the board consider a motion to go into executive session to consider whether to issue investigative subpoenas in case numbers 2025-030, 2025-009, and 2024-005. Of course, what I meant to say was that you consider to close the meeting
Correct.
to consider whether to go into executive session.
So there's also a personnel matter that needs to be discussed as we are planning to go back into executive session. Can we also include that we'll take them separately, of course, but since we'll already be back in executive session, can we also include in that the consideration of our discussion regarding a personnel matter?
Yes, ma'am. We'll just need to make sure that the minutes specify that then, the correct subsection for the investigative function and the personnel function. Is that correct?
Do we want to? But the question is, do we want to do this first? Or I do know I have a guest who's here to speak as well. So why don't we do this? Dr. Volters, you've been so kind as to sit through a whole hearing to be able to address this body. We were looking for you this morning. We actually pulled somebody in who was pretending, who was masquerading as Dr. Volters. But since you've been here, why don't we do this then? So rather than moving on to item 18, we will hold 18 and do this. But what I'd like to do is kind of go back and give Dr. Volters an opportunity to speak and address the board on behalf of MSMA. As you know, Dr. Volters is a past president of MSMA, and he wanted to specifically speak on something that we've heard a little bit about. Dr. Cleveland mentioned the foreign medical graduates and the issues about licensure that we met with Cicero about on yesterday. This is something that's coming down the pike. It's not just something unique to Mississippi. And so Dr. Volters wanted to come and address us with respect to that. So why don't we go ahead and give him an opportunity? Dr. Volters, if you will, we'll go ahead and give you the floor and we will hold on the.
Is Dr. Loper still here?
Oh, yeah, go get Dr. Loper. He recused and he's.
And so that Dr. Volters doesn't have to defend himself. He was provided the wrong time by us to be here.
I understand.
So,
That's okay.
I mean,
You should just be really excited. There was somebody who was ready to hop up to the podium and start talking. We were like, that's not Dr. Volters. And he's like, actually, no, I'm not. Thank you. So just as soon as we grab our other board member, we'll have you come on up. Did he leave? Oh, okay. All right. Well, never mind then. So he fully recused. Okay.
Had a good laugh.
Yeah, you can come on. Yes, I don't think that I think he's no longer in the building, so that's fine. Come on.
Thank you so much. I'm sorry about the confusion. I really appreciate it. Yeah, this is a subject dear to my heart. I am a international medical graduate. I used to be a foreign medical graduate when I was elevated by society to an international medical graduate, which is a much grander term. But just to put it in context, this is something that's very relevant to the practice of medicine now. As a lot of you know, I am a delegate to the AMA, and I'm also very much involved with the IMG section of the AMA, and hopefully will be on the governing council soon to do that. And it's a national issue. About 25%, just to put it in context, 25% of the physician workforce in the United States are international medical graduates. In rural areas and underserved areas, that's significantly more than that. In subspecialties, things like geriatric medicine and nephrology, 50% of physicians practicing those two subspecialties are international medical graduates. Internal medicine, endocrinology, and infectious diseases, 30% of the workforce. So there's a significant amount. For a long time now, state medical licensing boards have had to assess how to treat international medical graduates, and there's a whole bunch of issues regarding them. I think the low hanging fruit is that there are well-trained medical graduates from foreign medical schools that come to this country that want to practice medicine, and they are treated very differently from American medical graduates. And is that fair? The short answer is, and I wouldn't be here, it's not fair. And very often they're treated as second-class citizens as they go through the system. And I think as Dr. Owens was alluding to, there is a national conversation now amongst state medical licensing boards is how can we get a fair and equitable way of getting appropriately trained good doctors to practice medicine in our states. And we know this is very underserved areas. And what has happened is, in essence, what has happened is that we are being denied good medical graduates, physicians, and while we are certifying mid-level providers to practice medicine at a much lower level than needs to be. And all the data shows, as we all know, that the mid-level providers do not provide the standard of care that medical graduates do, and yet we're denying that by making sometimes quite draconian regulations to get these international graduates. So what can we do to level the playing field, so to speak? And there's a draft that I know Dr. Cleveland has, and Dr. Brunson provided it to me, and I'm sure the board, if you don't have it now, will have it. It's a draft that's coming out as a report, and it's a joint task force between the Federation of State Medical Licenses, of the ACGME, and a group called INTEF who do a lot of this work. And it basically sets down what would be fair. And I really would like the board to seriously consider these recommendations that are coming down. Obviously, at the top of the list is every state needs to make their own decisions and have their own pathway. And we're talking about an alternate pathway for international medical students to get medical license and practice in the state. So obviously we're talking about Mississippi here. And I just wanted to do some highlights and maybe some things that when you do talk about it, as I hope you will talk about it, I'm sure you will, the things that you may want some more clarification on. These international medical graduates that are going to be applying, and hopefully that at some point in the future, the Mississippi Licensing Board will have an alternate pathway for them to apply on, will be medical graduates from approved medical schools and other countries. And again, you know, obviously medical schools from some countries are better than others. I think the easy ones that most people will agree would be equivalent to American graduates would be Australia, Ireland, Israel, New Zealand, Singapore, which I was surprised about, but apparently Singapore has a very, very high standard of medical education, South Africa, Switzerland, the United Kingdom, of course, which should be top of the list, and Canada. And so that's sort of the easy. So medical graduates coming from those countries who have graduated shouldn't have any difficulty. Obviously, they have to provide the appropriate proof of their graduation. Then they must obviously have immigrant status to be able to practice medicine. They must have, and I'm just giving you what most people agree is sort of the basic thing. They should have an employment agreement so that they have a job to come to. And then it gets down to things that I think is going to somewhat be able to discuss. We're talking about medical graduates that have also gone through a postgraduate program. And this is where I think it gets a little sticky. And this is where I think licensing boards are going to say, well, you know, is this guy really, or this lady really, you know, up to what an American graduate would be? And they use the language substantially similar. So foreign medical graduate, international medical graduate must qualify from a program, go through a postgraduate program, which is substantially similar. Unfortunately, there is no world body, as far as I know, Ken, I don't think there's any body that has certified all these postgraduate programs. So there is data. The World Health Organization has data, and World Federation of Medical Graduates does have data for this. But I think it's up to the licensing board to decide what would be appropriate. But then they must have, gone through a 3-year program of graduate program, qualify then, and then to have to practice medicine in their country, have a medical license in that country for 5 years, and be in good standing, of course. And then with all those qualifications, then they can apply. And I think everyone agrees that they're not going to get a full license, even after all that, which I think is really, I think it's fair and reasonable, but they'll go through that. So these are qualified, experienced clinicians, but even after all that, they will not get a unrestricted license immediately. They'll get a provisional license. So Mississippi will grant them a provisional license after they tick all the boxes. And then some states, they talk about various types of supervision and proctoring, etc. And again, I think that's something that is going to be a board discussion, some sort of supervision or some sort of monitoring program. And then after 3 years of successful practice, then they will get the licensing board is committed to give them a full unrestricted license like everybody else. That's basically it. There are some other nuances, but that's basically it. So it's basically, agreeing that this is appropriate education, that they're experienced clinicians, and then coming on a provisional license so they are monitored. We have to create, and I think all states will have to create certain data collection means specifically for these individuals, and it's not available at the moment. And the states, I don't think any state is set up. 9 states have already done this. 9 states already have alternate programs for international medical graduates, and another 9 states are in the process of it going through the legislature or going through licensing board discussions. So again, as Dr. Owens said, this is not something that's just new. This is going on. And again, I say to you, we need physicians. We certainly need a lot of physicians, and I'd rather have a well-trained, appropriately trained international medical graduate than have, for my community, than have to rely on mid-level providers who have not gone through such a rigorous certification. What do you think?
So I want to tease your memory a little bit. And I think one of the additional issues that you had dealt more with regulations, and that's foreign medical graduates not qualifying for an unrestricted license until they have been through 3 years of training.
Correct.
Whereas a U.S. medical graduate, it's only 1. And so we can look at that. And then you have personally felt the experience of not being eligible to sit on this board because you're a foreign medical graduate.
Well, that was something I was not going to bring up because it's self-serving. But Claude, I talked to Claude several times, said you bring it up because it's not just about me. There are a number of physicians in this state, and this state is, I'm not sure if it's unique, but close to unique, who have served their community well. They've been strong physician advocates. They've worked hard to further good medical care and appropriate environment, both for physicians and their patients. And they're not qualified. They're not allowed to serve on certain things. I will say this, and I apologize. It sounds self-serving. 3 governors have asked me if I would be interested in serving on the licensing board, and I said I would love to, but I'm not able to because the Medical Act says that you have to serve on the board. You have to be, and I think on the State Board of Health as well. You have to be, you have to graduate from a American. I'm not even sure it's Canadian as well, but it's certainly American medical school. So I think that needs to be looked at. And the excuse I was always given in the past, not that I said I wanted it, but but people say, well, it's unfairly, you should be on anyway. But they said, well, it would open up the act, and then all the optometrists and all the nurse practitioners are going to jump in and want everything. We don't want to open that can of worms. That was always the argument. So anyway, but thank you, Ken. I wasn't going to bring it up, but I appreciate you doing that.
Hey, Lee, good to see you. Quick question. I think I know the answer, but I'm sure you do for sure. For a foreign graduate, international graduate that did not repeat residency in the States, are they ever board eligible to take American boards with that?
Yes,
They are.
yes.
So the minute they
Yeah.
come over, even without a United States residency, they are board eligible to sit.
No, they have to go through a residency program first.
Okay, that's what I.
And they can do, but they can do fellowships on J1 visas and things like that.
And they can't, and then there are, I think they use the word alternative pathways to
Yeah, that's what they use.
obtaining board certification.
Yeah.
Yeah, but those are, so the ABMS boards have some, I think almost all of the ABMS boards have some alternative pathway. It's very similar to this issue of creating this alternative pathway to licensure where they vary depending on what board it is. So the requirements are going to be different depending on which of the boards, because I'm only familiar with one, that would be mine. And we have an alternative pathway. But that pathway has not been mirrored in, say, for example, those people who have been foreign trained, who have come, and requested waivers so that they could be licensed, that have obtained board certification in the States through alternative pathways. They look very different from the ones that even we're experienced with.
I just mentioned that because I think that's going to be another net barrier that's need to be addressed, because a lot of health systems require like ABIM board certification. They
certification.
don't respect the American Academy of Scandinavia's board certification. And so, but anyway, thank you. And it's good to see you.
Good to see you, Randy.
And just, I know y'all thought you would never see the day where Ken Cleveland would be the politically correct police officer here. But the correct language now is additional pathways, not alternative pathways. So just thought I'd throw that out there for y'all. Additional pathways. Alternative has bad connotations.
It's not updated on our website yet. That's all I'm saying. So any questions for Dr. Volters? Anybody?
And I would just, the foreign medical graduates that are foreign trained, that would require a change in the law. The time to unrestricted licensure could be changed in regulation, just so this board knows.
And just for my own information, as I'm thinking through this, we're early in the process, and so this is being taken through legislatively in respective states, and everybody has the ability to carve out a process that they feel like works best for them. So how is the interstate compact going to work when you have multiple different processes that are pathways, or what did you say? I can't use the word additional. So these additional pathways, is it kind of one of those things where they may be additional pathways, but they all lead to the same point? And how is that going to work going from one jurisdiction to another? Because I could also see a way where, say, ultimately I want to practice in California, but I don't meet criteria for California. So does that mean I go work in Wyoming, and I work in Wyoming and have a blemish-free experience in Wyoming, and then I make my way over to California? Is that, I mean, I don't even know if the compacts even had these conversations, but I think as we're thinking about it, because that is in place, you would think that there've got to be people sitting around the table trying to figure out how they're going to manage that.
And it has not been discussed at the IMLC level. And I feel comfortable saying that since I'm one of the officers at the IMLC. But in my imagination, if I think about it, I would think you would start with the most restrictive state and apply those rules across the board. And then adapt as necessary.
Yeah, it's a good, very good question, Michelle. All the things I read, they're very cognizant. They're saying this has to be done at a state level. So I think they would always defer to the individual state saying, well, you can have a compact for this, but we're not sure about these IMG people, sort of thing.
Well, no, I appreciate it. And I appreciate you coming and helping to inform us and sharing your own personal experience. Because the whole time I thought you just didn't want to be on the board with us, but now all of a sudden I learned
How can I
something.
not want to
today.
be on board with
I
you?
learned
Come-
something today. All right.
And if the board decides that they want, more information and do a mini task force, I mean, I'm more than happy to be available I'll provide any information. As I say, I get a lot of stuff through the AMA IMG section, which I'm very involved with. So if I can help out in any way, I'm not happy to, of course. And for anything else that you guys, as you know. Thank you so much.
Thank you.
I'm really sorry about the mix up.
No, we accept full responsibility for that. But we were glad that you were able to still
Thank
come
you.
and make it.
Thank
Good
you.
to see you.
Take care. Good to see everybody. Bye-bye. Thank you. Bye-bye.
All right, so now can we go back to our regular agenda, item number 18? And Paul, you want to take your place at the green lit mic? And we've talked about the numbers of the subpoenas and the personnel matter. So now I think we just are at a point where is there anything extra you want to say right now, or can we entertain a motion?
I just wanted to ask for point of clarification, will you take the subpoenas up first or the personnel matter?
So the subpoenas first?
Okay, 'cause
And then
I
the
could be
personnel
there and then,
Yes, that.
yes, ma'am, I think it's time to entertain a motion. I think that would be appropriate if. Yes, sir.
Oh, I thought he's. Is there a motion? Dr.
Just need
Lippincott,
one,
would you make one?
one for both.
Yes. Well, the motion to close the meeting, and then when we do,
Okay, I'll make a motion to consider closing the meeting to enter executive session.
so it's been moved and properly seconded that we close the meeting to consider whether to go into executive session. Any discussion? Thank you. All in favor? Aye. Any opposed? All right, thanks. We're back in open session and Dr. Lippincott, our immediate past secretary, will give the decisions from executive session.
Thank you, Madam President. The the board has voted to approve the investigative subpoenas number 2024-005 and to approve the investigative subpoena number 2025-009 and to approve the investigative subpoena for the case 2025-030. And for a and also we were in a separate executive session regarding a personnel matter, and the board has voted to approve a 4% raise for the board has voted to to request a 4% increase for our executive director.
Thank you, Dr. Lippincott. All right, so that brings us to the end of today's agenda. Thank you all for hanging out, staying with us. So we are going to recess until tomorrow, where we will resume at 9 o'clock, 8 o'clock. It is going to be 8, still 8. Okay, just checking until it's done. I'm just kidding.
So it's three
Three
hearings,
hearings.
and I mean,
Okay.
they are definitely disputed hearings.
Okay,
So
yeah,
Um,
so,
it's an open-ended kind of,
yeah, so be prepared to stay for the long haul. Okay, all righty. So we are recessed until tomorrow at 8 a.m.